Hi, Linda. I'm good. Good morning. So. Huh? Yeah, that's fine. I don't know. Better to have one. Put it on. I mean, it just need to be in the frame. Good, that's fun. Good morning, everyone. Are we ready? No, I'm good. Good morning. Good morning. So caregiving, it's a big topic, right? Our last panel, Touch Talks Wellness on Martha's Vineyard. We've been here for 2 weeks talking about everything health related. And we saved the best till last. I really believe that in some part of your life, you're going to be a caregiver. My 93-year-old mom passed July 3rd. This is her, I'm wearing her. I was her caregiver with a lot of other support. But I think we all have a lot to say about it, and it's different for all of us. But yet the part about the emotional part about taking care of someone and being responsible for their well-being is a huge, huge thing that none of us really understand, and we sort of take for granted that something's going to happen that's going to take care of us until it happens. So I'm so happy to have this awesome panel. So if everyone would just introduce themselves, and then we will get started and talk about stories.
So I'm Valerie Buxton.
In the mic.
Oh, Valerie Buxton Punch.
In the mic.
Valerie Buxton Punch. I happen to work in healthcare, but just enormous family and friends that I found myself having to share valuable information in order to make their caregiving journey better.
Can't hear you. Can't hear you. Here, let me put the mic on. Yeah, I talked in it. Gotta hold it up, babe.
Okay, Valerie Buxton Punch. I work in healthcare industry, but just a large volume of friends and family members that I've been able to impart caregiving knowledge to, and for that would be my point of reference.
Hello, I am Christy Redmond Moore from Dallas, Texas. And that's my best friend Summer. I am a chemist by trade. However, I acquired my first funeral home 10 years ago, where I serve as the only woman to own in 3 of the cities in Dallas, in the suburbs. And I own my own crematory as well. And I speak about the importance of looking past the active caregiving aspect of your life to what to do once your loved one does transition.
My name is Nakia Clark. I am the Director of Community Engagement at the Ellie Fund, which is a nonprofit organization that provides support services to anyone going through breast cancer treatment. And I actually started this position after taking care of my mom, who had metastatic breast cancer. And after she passed away, I felt lost and needed something to do and started volunteering. And now I'm at this organization able to help other breast cancer patients.
Good afternoon, everyone. I'm Glenda Noel Harris. I am a retired physician of internal medicine, and I retired from a professional healthcare company where I provided healthcare in the jail setting. But my uniqueness about being on this panel is I provided care to my 107-year-old mother who died last year, and I did it from afar. So I'm here to kind of share stories about how you can do it and live distantly, but hopefully provide some insight into the tricks of the trade of how to kind of make things happen when you need them to happen.
So Dr. Glenda, the one thing you didn't say about yourself is that you are an incredible advocate. And that you've written a book about advocacy. I love Dr. Tony. But advocacy is a huge part of caregiving. So why don't we start there?
Okay.
Right, because I always say nobody should go to the doctor, no one FaceTime anything to have someone with you, but can you speak to that a little bit?
Absolutely. Thank you, Ricky. I forget. But I did co-author a book, Focus on Your Best Health. And it is all about patient advocacy. We talk about the importance of how to communicate and navigate, and then you can advocate. If you can effectively communicate and understand how to navigate, then that makes you a great advocate. The other thing that's really important about advocacy, we believe, is that you don't have to be a doctor to be an advocate.
Right.
As was mentioned on the previous panel, you should go nowhere alone when you're going in a medical setting. My feeling about that is most of all in the emergency room setting. You are very, very compromised. You are not yourself. And very often when the doctor is asking you questions, you really don't answer them in the correct and proper way. But advocacy is a concept that my co-author and I sort of blundered up into about 18 years ago and decided to write this book because we just felt that we could get around to the world to tell the world about the importance of it. In order, and I guess I have to be sort of like you, Ricky, is that I've now been wearing that gown with the back out, and I've been on the other side of the table a bit more. And if those of you who haven't, just live a little bit, stuff will happen to you. But I have found myself on the other side of that table, and I have had to say to my physicians, if you were on this side of the table a little bit more often, then you might really understand the questions that I'm asking on why I feel the way that I feel. But it is important that you bring an advocate with you to the doctor for every single encounter. You also need to bring your questions with you to the doctor, write them down. A medical encounter can appear to be very intimidating. It shouldn't, because you're paying his or her salary. They get paid from your premiums.
Right.
And you need to recognize that your companies are paying for your premium, or you're paying for your premium, or you're jointly paying for it, and you deserve exactly what's going on in that exam setting. So write your questions down. Don't be intimidated by the engagement. If you run out of time, book another appointment, because you can't really be a good care provider of yourself unless you really know what all the rules are. I'll give you a quick example and I'll pass the mic. My son called me yesterday. He had some kind of skin thing and he couldn't get in to see our regular dermatologist, so he had to go see someone that was unknown. So he calls me to say, well, this is what she recommended. And she said it wasn't covered by the health plan. But when she told me it was only $300, I said, oh, I've got the money to pay for it. And I asked my son, who grew up in my household watching me ask questions, Philip, what is it that they said you have? Oh, I need to get back to you, Mom, and tell you what that is. Did you ask her, what are the side effects and complications of this treatment that he or she is recommending? Oh, okay. Philip, do you have a pen? Write this all down. And then go back and ask, and if you don't get the treatment, what could happen? And if you get this treatment, are you going to have to do it again? I mean, you really have to write your questions down. You have to ask. And I will also say, when you start asking those kind of questions, they know there's a doc in the woodpile somewhere.
Right.
And they start getting alert and oriented and begin to start answering questions in the way that they should be answering them anyway. So advocacy is the way. Take your husbands, ladies, take your husbands to the doctor, sit there with them, ask the questions. Your kids are not just the people you're responsible for. You're responsible for that man too.
Right. I would just say 2 examples of what we're talking about as far as caregiving just happened on the stage, right? You introduced yourself, but Ricky had to enhance what you were saying. You very well know who you are, you know what you do, but Ricky had to enhance what you were saying. And also, when talking about your son though, you could remember what all those questions were, because you're thinking about that person, that son, in a different way than you're thinking about yourself. So when you're talking about what do I need to know, I can just tell you that when you are sick, when you're not feeling your best, when you're not doing, when you're not thinking about what does this mean for me? And you're more thinking about, if I'm sick, who's going to do these other things that I do for my family? You need someone to say, no, 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 you told me you felt this or that or the next thing. You need someone to say, okay, so what happens after we do this? How long is this ailment gonna last? What is gonna be the next follow-up care? You're not thinking that when the doctor says to you, this is what you have, and this is what we're going to do to fix it, right? You hear that differently than the advocate does. So the advocate is there, not because you can't handle it, because, you know, I will just speak for myself as a Black woman, we're supposed to handle all the things, right?
That's
The advocate is there because after you handle it, there's going to be these other questions, these other things. And I would bet that that's what happens in your line of this, right? After the transition, there's this thing that happens. But we have to all understand that when we're getting this information, we're all learning something. Like, I learned how to be an advocate when Ricky taught me, okay, well, we only want to tell the story one time. So we're going to have a Zoom, and we're going to do this, and we're going to, never thought that healthcare could be like that, that what we need to do for one another, that knowledge can be imparted that way. So we have to always be willing to come in the room to the table with our best assets, so that we can either use them for ourselves or use them for others, but we can all hear the same story differently. And that's why it's always important never to go alone. Like, not because you can't do it, but because there's a better way to do it.
right.
You know,
Well, you can't. If
Well,
you're the patient, you
that's
can't.
right.
You're on fire.
And if I may,
Go for it.
I wanted to also say, 4 years ago, I was diagnosed with type 1 diabetes. My pancreas shut down from stress. I'm a very, very independent person, the oldest on both sides. Eldest on both sides. I've always been the one to take care of other people. So as my body started to shut down, I didn't realize you're in danger. It wasn't until my glucose was about 600 and my ex-husband had to rush me to the hospital. And I'm saying this to say, as I'm laying in the hospital bed and it's time for me to ask the questions, the doctor comes in and says, so we're gonna go ahead and take you in for dialysis. And if my best friend Summer had been on the speakerphone, who's a CRNA, to say, wait, she's not there for that. They had the wrong chart in their hands. And I'm laying in the bed, I'm out of it.
You have no idea what.
I have no idea what's going on. So I'm saying all that to say, if you are by yourself, get somebody on the phone. If you can't get someone physically in the room, have somebody on the phone. You're never too independent to ask for help. It doesn't mean that you don't know, it means you need help, and it's okay.
And I also want to add, one of the things you also want to do is, with my mother's case, it was very complex. Medicines change. Write down the symptoms that you're having, so that when you go, the caregiver, so that when you go to the hospital, you can say to the doctor, these are the symptoms that this person was having. Because my mother was good for telling me, but when we got to the doctor, she became mute all of a sudden. So I was there to say, wait a minute, remember you said this happened, because it could be something with the medication. It could be a side effect. It could mean that the disease is progressing. So also always bring a notebook, and as you said, have someone on the phone. There were times that I couldn't be actually there, but we would FaceTime, and also know the team. She had an array of nurses and doctors, and I knew all of them, and I had their contact information so that you can call in. One more important thing is be the healthcare proxy, so that if that person can't speak, you have the paperwork to let them know that you.
That's a
can speak to
really
them.
important, right? And know that the hospitals, the providers' offices, if you have to go alone and you're with FaceTime, you can ask for a social worker. You can ask for, some hospitals, like my hospital calls it the lavender team, meaning it's the calming person that can be in the room with you. They can't speak, but they can be a comfort to you. So you can ask for that person to be available to you. All major hospitals have a team of people that would be available to do that. And you can also ask, you know what, this was a lot. I need to reschedule an appointment. I need to be able to bring somebody. You don't have to, 90% of the time, you have an opportunity to come back and to have that information disseminated in a way and in a forum so someone else can hear it. You don't have to feel like that if you don't buy this car on sale right now, you can't get this car on sale. Like, you don't have to have somebody rush you into doing something like that. You always have the opportunity to ask for the opportunity to ask another question. There are not too many questions.
But you may not. I mean, I don't know that we have a patient that got diagnosed, we diagnosed 3 cancers. And one of the patients, she went home, she went to her primary care doctor. She won't be able to get a mammogram until September 15th. So when we get off of this call, I'm gonna go raise hell to try to get an appointment tomorrow. You know what I mean? But I think, because she just said, okay, well, I'll wait. No, you're not gonna wait. You know what I mean? So I think we have to fight for everything, I think also, like, my mom was taking 37 medications. So every time we went to the ER, which there were many visits, I would say, well, what's your mother taking? So I had to like pull out my little phone I had in my phone. But I mean, like, you have to go in there with information, you know, and if it means you have to take all the bottles with you to the ER, take them all with you. But, you know, you have to sort of make sure that you're informed about what your patient is dealing with, you know what I mean, and know what they're up against. Because I couldn't remember those meds. My mother could rattle them off too. Till the day before she died. But I would sit there with my little list and, okay, do you remember this one? But know your stuff when you go there, be informed and protect your patient.
Yeah, Ricky, if I might add regarding the mammography situation, a couple of other tips. One is be persistent.
Oh, yeah.
Just keep
No,
calling
it's
the
never-
mammogram
yeah.
office every day.
Yeah, no, it's
Because
never
pe-
the answer.
Because people cancel all the time.
Time.
And then the second thing is learn how to get yourself on the wait list.
Yes.
With my company, you can just check box if you want to be on the wait list, but I promise you, be persistent. Many of the times, the people that are making those appointments are women. They know they want to get you in, but people do cancel. And if you are persistent, you will get in.
You'll get in.
The other point about the 37 medications, oh my goodness. So one of the things that often happens to people is they'll go to the emergency room and they'll get them started on this medicine, and then they go home and then they don't get to see their primary care doctor, but then they have another emergency room situation, and then they go back and then the medications are not communicated. One of the things that I used to do when I was in practice in primary care was to just start removing stuff. I mean, it takes guts,
Right.
but I can't remember to take 2 or 3 medicines a day.
Right,
How on
right.
earth can anybody remember to take 37 and generally they're multiple times? So if you're with a loved one and they're taking more than 4 or 5 meds a day,
Who's wrong?
you may want to ask the primary, does he or she really need this? Because many times they'll say, oh, are you still taking that?
Right.
The medical assistant is supposed to double check all your meds when you come in. But if you've been in the week before, sometimes they'll skip that. And so it doesn't get addressed. But anybody that's taking more than 5 or 6 medications, and especially if you're taking them multiple times a day, your compliance is going to be really low. It's just the fact that you just can't spend your whole day taking medication. So take a look at that and really ask some questions about that.
And be clear, the person who gets the urgent appointment doesn't get the urgent appointment because you call at just the right time. You get the urgent appointment because someone's calling for you daily. There was a cancellation. You're not going away. You've called the doctor's office and you told me that this was an emergency. This is what they said. And now you've got the doctor's office calling on your behalf. You have literally, you might have the chaplain or your minister calling on you. There is not a stone you should leave unturned if you were told that this was important and that you needed this right away. And you don't know these people. At the end of the day, you called and maybe they were annoyed, but they're getting paid to be there. Somebody has to call them. It's going to be fine, right? And call back tomorrow, right? Because it's going to be fine if you do that. You cannot let anybody prevent you or give you the roadblock to you being able to live the life you want to live. So don't let them throw false flags. Demand the care that you need to have. In the last panel, they were talking about this as it related to insurance and what you needed. That's all a part of this also. You might not have an insurance that says the doctor is in network, the hospital isn't, or this. That's why there are things called single case agreements. That's why there are things called payment plans. That's why you need an advocate there to say, oh, okay, well, what are my options? because we always have options. But when you're sick, you might not think of it that way. That just might be another roadblock. No, that's why you have people advocating on the back end in order to make that happen for you. Because as this one taught me, no is really not an answer. It's a sentence, but I don't have to, it doesn't have to be the end, right?
It's
And
how-
so you can always go back for a different answer.
From a networking perspective, I would ask everybody, well, let me just first ask, how many women are in the room? So the statistics report that 68% of caregivers are women. So if you're not providing any care to anybody right now, just hold on, it's coming.
It's come.
To a, near you.
To a station near you.
To a station near you. But from the standpoint of what was mentioned earlier about the doctor was in network, but the hospital was not, I encourage each and every person in this audience to go back now while you're feeling good and find out where your stroke center is and find out if that's in your health plan. Find out where your cardiac center is. We talk about this in our book. This is a part of navigation. Know where the centers of excellence are in your community. So when the ambulance or the paramedic shows up, you can say, take me to Good Samaritan, take me to so-and-so. Sometimes they will argue with you because if it's trauma, they've got to take you to the high trauma center. But you don't want to carry a patient with stroke symptoms to a facility that doesn't handle strokes. And you need to know, because you will be stuck with the bill of facilities that are in your network. I mean, there generally are facilities. So that's part of your responsibility in owning your insurance plan, to know who's in network and who's not in network. That's something that I think a lot of people just think, oh, all hospitals just cover everything. And that's not the case.
I love that, Dr. Linda. I love that so much. Be prepared and do it when you're not sick. Because so many things happen when you're in a crisis. And especially stroke, because you can reverse it. And so I love that. We're gonna write a blog about that. Know where your hospitals are, right?
Know what your resources
Know
are.
where your resources
Know
are.
what your resources are. When nobody wants to, they get the new job, they're excited, and then you got to go to HR, right? And nobody's like, they're like, you're picking the insurance and you're saying, this is what I can afford. But sometimes listen to HR, because yes, most 30-year-olds can afford the lowest level because of this or the next thing. But are you a 30-year-old because you might have a pre-existing condition or something like that you need to go to the next level? Ask them, can I get back to you at the end of the week? And then go home and read through those levels and read through those packets. We never think of that being part of caregiving, but like in my house, we might not need double coverage for the health part, but we might need it for the dental part. We might need it for the eyeglasses part. Like, we have to think about when we're asking our children, so what's your insurance? So what is it that it offers? So where does it say you need to deliver that baby? Like, we need to understand that caregiving starts or can start before the crisis. And we don't want to talk about that, right? We want to talk about, how was your first day of school? How was your this? But when we start talking to our kids about what was the first day of the job like? What is the package like? Not what you make, but what are the accoutrements that come with this package? What are the things that you can do? Because sometimes you can get medicines as part of your pharmaceutical plans, and you can get these various different things, but we need to know. And we need to start having conversations at the table about what these things are and what they offer. What are the golden slippers, right? Why should you go to the mall and walk around the mall like this? And what are the benefits of these things? And not just getting you out of the house, but that's when Walgreens opens early for some of the seniors. And you can talk to your pharmacist about the meds, and you can do these things. It's important to know all the things that are available to you, and that's part of the caregiving.
And do that for your parents. I mean, when you start to take care of your parents, even more care than normal, understand their insurance,
Right.
Understand who their doctors are. My 95-year-old stepdad called me yesterday. My mother has been dead for 5 weeks, to ask me what the dentist name is. Because she handled it, right? He didn't know. I mean, he actually has sticky notes all over their house now about what their address is because you never.
Wow.
But I mean, but find out what your parents are eligible for, understand their care and make sure somebody is their caregiver, is their point, what do you call it? A POA, that somebody is in charge of their care. Because you don't know when something will go wrong and they won't be able to speak for themselves and they need someone to do that for them.
And you brought up a good point when you mentioned, we're talking about parents, but children. I
Children
have an
do,
adult child and I have an HR background, so she comes to me and she asks me, she showed me all of the benefits package as you were talking about. And one thing you have to make sure is that they give you time, they give you a couple of weeks to decide which insurance you want. Look up the doctor as well as the hospital. We talked about that the last panel to make sure you're covered. Because if you're not, then maybe you have to change to a higher plan, which your doctors will accept. And that might be a higher cost, but it's more beneficial to you because you've already had those doctors gone to this hospital. So we have to also think about our adult children who are trying to navigate the system as they're starting working.
And the last panel spoke about what happens if your insurance has to change urgently. And probably a month, maybe 2 months ago, I literally, for the first time, I think it took my daughter, I think she was on the phone, she said for 6 or 7 hours trying to renew insurance, right? That to me made her more anxious than the date was gonna pass. Because you're sitting there and you know you need the thing, but nothing should be this hard because I'm trying to do the right thing. And I might have missed the mark on caregiving that day because in my mind, I kept saying, there has to be a better way, but I couldn't come up with what the better way was. And I knew she needed this thing. And yes, that's when you say, well, this is why I vote and this is why I do whatever. But I think I missed the mark because I think what I was supposed to say was, it's gonna be worth it, right?
right?
But my heart went to, this is just wrong. But the answer was, it's going to be worth it. This has a value. We need you to have this thing. So we won't let this defeat us or you or whatever this is. We have to always encourage, this is a horrible diagnosis, but we're going to get to the bottom of it. We're going to come up with the answer. We're going to do whatever. What that means as the caregiver is you're always getting out of your way because you know you're having to do this other thing. But it's going to be worth it. And we have to constantly remind ourselves why it's going to be worth it, right? Why tomorrow makes it worth it,
Right.
you know?
And I can definitely attest to when I am working with families once their loved one has transitioned, and the anxiety and the guilt that they feel that they did not begin or recognize their role as a caregiver sooner. Just because you are not changing someone's bedpan or helping them get in the bed each night, that does not mean you're not a caregiver. If you have a responsibility of helping someone get through their treatment plans and the type of medicines and the type of insurance, you are maybe an indirect caregiver, but you're a caregiver on your way to being an active caregiver, possibly.
Yeah.
And so when their loved one passes, they're like, if I had just started this process 5 years before, it would have been such a mad dash and a rush to figure out the Medicare, Medicaid, and all the things that they missed, they could have already had planned out. So this is really a conversation about caregiving, also about legacy, and about starting when your children are young, and the conversation that you have with her when you said you feel like you should have told her it's going to be okay. Those type of reassuring conversations helps that when your loved one does transition, you can look back and say, I did everything that I could responsibly to get them to where they needed to be. And then you can then move forward and rebuild the life that you had before you became an active caregiver.
That's awesome. A lot of that's sort of like some logistical, mechanical things. let's talk about the emotional part of caregiving. And I'm not even gonna talk right now, but I mean, think about like the emotional burden that you feel as a caregiver. What does that feel like, and how can we help people kind of work through some of that? And you know, the data shows that 30% of caregivers die before the person they're caring for. And I used to always tease my stepdad, you know, my mom was 93, he's 95, that he was killing her.
Yeah.
Emotional, like, go get this, I hear him, Wilma, calling her for anything, any little thing, and she handled everything. But he's still there,
I have that.
you know, so like, what does that look like for all of us?
You know, I see that all the time. The people who were giving the care are in my morgue, and those they were taking care of are making the arrangements. And that is usually because the caregiver is giving so much, all of themselves, and they're forgetting about taking care of themselves. They're not drinking the water. They're not taking the walks. They're not doing all of those things. And so when I'm speaking, I tell people, you have to put yourself first, God, then self, then the person that you're in charge of. Because at the end of the day, one of you are going to leave quicker than the other. And if you take care of yourself, you can see them through the process, and then you can continue to live your life. Being a caregiver is not supposed to make you kill you. It's not to kill you. It is for you to provide them a comfortable environment so that they can live as long as they possibly can. But you'd be amazed how many people that we bury or cremate that we're taking care of others.
Yeah.
It's unfortunate.
Yeah, I think one of the things I like to emphasize is caregiving really is a partnership. And it's sort of like they talk about on the airplane. Really, if you're not healthy, you can't take care of anybody else. I think we really, as mothers, do a really good job of that with our children. But somehow or other, after they get past the age of 16 or 17, when we're providing care for loved ones, for parents or for spouses, somehow that just it goes over our head. But I like to encourage people that when you recognize that you have a loved one that you must care for, you must begin to think about the importance of respite care at the time that you begin the initial care.
Yeah.
Because isolation, stress, the emotion, the feeling alone, you can be in a family of 8 siblings and it's you that's caring for the loved one. The stories are endless. It's not just one family, it's multiple families. And there are facilities that will provide you with respite care. And you just need to look into them. And I recommend that you look into them when you're starting the process, not when you're exhausted.
Yeah.
You know, in the questions, some of the questions that we received from Ricky, it was about prevention. And so what I'd like to share a little bit today are tips in prevention. So I'm just saying, as a caregiver, find that sister girl in town that says, let me know how I can help. And that's when you put that in the back of your mind and you say to that person, well, you know, I really may need you to come over here like 3 Saturdays from now to sit for 4 hours while you go get your hair done or your nails done or see your therapist.
Yeah.
Because I also encourage therapy when you're dealing with caregiving too, because somebody's going to go in the process. Either you going or they're going. And you're going to need therapy in the process. That watching your loved one not be the person that they were is draining, it's stressful, it's depressing, it's all of the things that I could say that are not positive. But I will say that if you can find a way to be there when they're in those phases, then oftentimes the guilt is not there at the end.
Yeah.
Because you've been there at the bedside and you've navigated for them. So look ahead for respite care.
I wish I knew you when I was going through this with my mother, because when she was going through metastatic breast cancer, I was diagnosed with breast cancer. And it could have been the stress. It wasn't genetics, but it could have been the stress because I was putting all this on myself. And I come from a huge family of cousins who were there to help, but I wanted to try to do everything on my own. And it caused me my health. And then I'm like, well, who's going to take care of her while I'm trying to heal? And I don't even think I healed properly afterwards because I was so worried about getting back in the field and trying to help her, even though we had all these people who were willing to help. So again, I wish you were around when I was going through that, because there were a lot of things I would have done differently. And I'm glad that I'm on this panel because I want to encourage people, get the help. You cannot do it all alone. You may think you can do it all alone, but you can't. There were nights that I would go home after taking care of her that I had to outlet. So I wait until I got in the shower to cry because I never wanted her to see that I was going through these things, but it was frustrating. And if I would have just reached out to the people who said, hey, how can I help? Things would have been a little bit differently. So thank you for saying that.
Partnerships are valuable, right? And we're taught early on in life how to be partners, right? And then some of us have the fortune of maybe marrying and being a partner, but you're a partner before you even realize it. And that's what happens when you're a caregiver also. You have to partner with the person and you have to make sure that you're aligned with what the goals are going to be, right? Because everybody doesn't have the same goals with their health, right? And you have to partner with the other people that can help. My mother-in-law passed, and my brother-in-law was awesome. This is her network. These are the doctors. This is the thing. And my mother-in-law would be like, I'm going to go to this appointment because Kevin said, but this is what's not going to happen, right? And she was very clear. She wouldn't tell him, but she would tell me, or she would tell my other sister-in-laws, I'm going to go because he's not going to rest until I do, but there's going to be no more surgery. There's not going to be these things. She was a nurse. She had rules, right? And he wouldn't hear it from her, but he would hear it from me, or he'd hear it from his wife, or I'll never forget. They said, they did an MRI one time. And first she said, why the MRI? He said, it doesn't cost you anything. And she said, I'm gonna do it because he asked, right? And then of course they found an aneurysm. They're gonna find something, right? Or they wouldn't do it, right? And I said, well, you're gonna see the best specialist at the hospital. And she said, why? And I said, well, because Kevin asked me to find the best person, and now you're gonna go. And she said, I'll never forget it. She walked into the office and doctor came and he said, and this is the thing. And she said, listen, you seem like a nice young man. There's not gonna be any surgery. This is not a new problem. And I'm 85 years old. I don't need to even be here because you don't need to do surgery on me. And he laughed, and my brother-in-law was mortified. And he was going to do but mom, and the doctor said, no, you're absolutely right. And I won't veto it because you're absolutely right. But if you were wrong, it's not wrong for them to have you here. But you have to always keep in mind that everybody has a say, right? And I've learned recently, not just through her, but I've learned recently that when you vote no, that doesn't always necessarily mean no either, because, I think that you just have to be able to have the say and be heard. And as a caregiver and as a patient, you have to make sure that the goals are aligned so that everybody can get something out of the process, so that we're not in the shower, right? So that we can hear one another at the table, right? When we're having these discussions, because that's all a part of the process to be heard.
Yeah, I'd like to encourage sister girl support. I just have to say, I have a group of sister girls and we meet regularly and we talk about everything. And the good part about it is that when we leave dinner, we know it stays right at that restaurant. That's often the problem when you have conversations, is you find yourself on Facebook the next day.
Right.
And so we don't have to worry about that.
Right.
But some nights when we will meet, the one in chair A will carry the entire conversation, because that's where our energy needs to go, to support chair A. One night is my chair, and nobody gets to say a word because I'm pouring out all of my issues.
Right.
But we support each other. We have all had some challenging situations, either with ourselves or our loved ones, and we support each other. And when somebody gets sick or there's a hospitalization, we're looking around, there's food coming in. We didn't ask for the food. The food's dropped off. The phone call, do you need a ride to this appointment or that appointment? And so I also encourage you to use your own network, your resources that are right there with you, because your friends want to help you. And nothing disturbs me more than when I find out from one girlfriend that the other girlfriend's spouse or something is going through something and I didn't know about it because I feel like I've had a missed opportunity. So reach out to your own, because they too have had caregiving experiences. And when you talk about resources, they can let you know what some of their resources have been. You might even find a caretaker to give you that respite care because they took care of their mom or their dad, and the person may be looking for a little extra help. So, you know, don't deal with caregiving in isolation. I think that's one of the messages is
So important.
it's, yeah, you gotta reach out for help.
When I was sick, I was, never gonna ask for help, we're in the Purple Cave doing all the things, right? And my friends just showed up. She was one of them. They didn't talk about it. They didn't ask me if I needed help. They just showed up. People were cooking, people were coming, helping me sell my house. I mean, like doing all the things. They redid my bedroom, and made it a palace for me to have chemo. And we never talked about it. Somebody would come, somebody would leave, but somebody was in my house for a year. And they were my friends from my whole life, from childhood, from college, from working, and many of them didn't even know each other. And so I started a club of them called SMAD, Sisters Making a Difference. And now we have a prayer call every Sunday night. And since then, it's now been 15 years, but since then, one of them had a kidney transplant, we took care of her. One of them's husbands died, we took care of her. So it's become a caregiving sisterhood, in a lot of ways, but what happens at 8 o'clock on Sunday night? Stays in whatever happens at Sunday o'clock. And I think it's given us this safe space to talk about all the things that we're dealing with. And they helped me so much with my mother. You know what I mean? And my mother came on the prayer call many times. And I think they helped my mother, which we talked about earlier too, she fought like a girl and fought like a girl and fought like a girl and fought like a girl. She was so sick until she wanted to fight like a girl anymore. And then she died the next day. Do you know what I mean? But I think that to me, the struggle was a fight. She was so sick, and we would go to the doctor, and these white doctors, oh, Miss Wilma, you can live to be 100. She couldn't live to be 100. I'm like, you're lying to my mother. Tell her the real deal about her health. Because I think, people are optimistic about old people. Like, no, she's not going to live to be 100. Like, tell her what's wrong with her and let her have peace with that. But I think my group of women helped her find that peace, that gave her the peace to say, okay, I'm going to go do the happy dance. So, but I think you do need support. We all need support. We all need support. And I think even just what you said about a therapist, everybody needs a therapist. Right? It's okay. There's no stigma about it. So somebody else asked a question or bring up an issue.
I wanted to bring up the notion about anticipatory grief.
Great. I love that.
So anticipatory grief is just that. You're anticipating something horrible is going to happen. And that usually occurs when you get a diagnosis about yourself or someone else. Grief itself is a silent killer, and it will cause disease that can be terminal. And so what I tell people is when you have someone in your life that you're expecting to pass because of a diagnosis, or you're taking care of them or what have you, you have to always keep the mindset that everything is going to be okay. You have to talk to yourself, because if you walk around, no matter how you look on the outside, but inside, you're cringing every time the phone rings. Every time you have to go to the doctor, you're holding your breath. If you're doing that, you're hurting yourself. So do your best to always think up, keep your thoughts pure when it comes to the person that you're taking care of. And then when they pass, you won't have the guilt that you did not take care of them fully with the correct mindset.
And know that that patient is dealing with their own grief.
Yeah.
when you have metastatic cancer, or you can see that, you're not gonna get out of here, or you're gonna get out of here soon, you're going through the phases of grief. And I watched my mother do it,
Yeah, in terms of kind of take home points, because I know our time is getting
Yeah.
short, I just wanted to share a couple of tips of things that my sister and I have often done when my mom was in the hospital. And that is, it has to do with kind of be kind to the people that are caring for your loved ones.
hello, know their name. bring
Know
them
their
Starbucks.
names. My sister and I used to, every time mom would go in the hospital, I mean, this sounds probably very silly, but it helped. We would always make sure that when we came in every other morning, we were bringing the nursing staff a dozen, 2 dozen donuts,
Yeah.
bagels, whatever, a croissant.
Right,
There's something being in a hospital where we just do a lot of frantic, ridiculous eating, but having that at the nursing station, and all you need to do is put, Newell, room 102. Because what they'll say is, who brought these in? Oh, bed 102 brought them in. I promise you, your mother or father's gonna get different care. When they ring
promise
the
you.
bell,
I
oh,
promise you.
that's the donut people.
right. I
And the
promise.
same with the doctors.
Right,
We had a doctor that operated on my mother for one situation. My sister and I went out, I think we got him cufflinks and collared shirts.
right.
And when she had another situation, we went and said, we want you to operate on mama again. And when he came out, I think he had sweaters and you name it, because there was nothing that we could not buy for that doctor, because he brought, my mother honestly died at 107, but she was a cancer survivor for 2 cancers.
Yeah,
And what took her out was not cancer.
Right.
And so she had really good doctors, and we tried our best to take care of them. Doctors are human too.
yeah,
They like to be loved and appreciated. Nurses are often
Yeah.
now working overtime.
right.
They're being mandated to do extra shifts. And so when you just go up there and you're smiling at that nurse and you're bringing sandwiches at lunchtime, I promise you, when your loved one rings that bell, they're gonna get different and quicker service for that bedpan.
Yeah, for sure.
And I just think the other thing that the other thing you need to know is, and that faithful day comes and it's no longer, you're not done, right?
You're not done.
And that's why you need the therapist and the sister group and all the things, because you still need the care and you still need the infrastructure and you still need the support, because now that you don't have to go to the ER, what are you doing with the time?
I know,
Right?
It's a
Like,
transition. It is.
You have to do these things, and you have to allow yourself the process, because when you don't, my dad passed recently, and my aunt was doing all the things, and she did it for my dad, and she did it for her mom, and she did it for another brother. She died. And so now it's like, well, Valerie, you have to call the Bureau of Statistics and Vital Records and get this happen. And you have to do this. And I'm like, but I didn't like him. Like, why? Like, that was her brother, right? Like, why?
Yeah.
And that's a conversation
Absolutely.
that I wasn't prepared to have, because like, it has to happen, right? If not me, then like who, right?
Yeah.
And so make sure that you have, because the caregiver always needs to be propped up and held up in esteem, but propped up and supported themselves, because it just doesn't end because it ended on, October 1, 2025. It doesn't end. And you have to know that, and you have to be prepared for that grief, as you were saying. So it's just very important that you know that it's a process, and the process does not have an end date, and you can't make that happen, automatically.
And find something that you love to do that you may have had to put on hold because you were taking care of someone. Because when my mom passed away, I was like, what do I do now? I'm so used to the structure. She was going to her appointments. I was cooking food. I was doing all these things. I was making sure everything was in, and then it stopped. It just stops. And so find something that you love to do that you can pour all that you was giving to that person now you can pour it into yourself, because if not, you'll go into this deep depression once they're past. And I found it, and I'm glad that I did, because I'm so passionate about what I do, and have those tough conversations. That's one thing I didn't do when they're here, so that you don't have that lingering when they pass.
For me, my stepdad is still alive. He's 95. He has 2 daughters. But when he had to go to the dentist yesterday, who did he call? So my job isn't over because I was the caregiver for both. And so I still have a job. I thought I was gonna have a little more freedom from that, but it doesn't go away. So, but I think you're right. There still is a void in terms of like, what do you do? How do you take care of that? And take care of yourself. But I think it all starts with, put the mask on yourself every day first. Your peace is non-negotiable. And figure out how you're gonna be able to give of yourself once you've given to yourself first, right? Right. Anybody have any closing words for this awesome conversation?
I have one more tip.
Go for it. Give us many more.
Another tip is, we as people of color, I know, mama said, I never want to be in a nursing home. That's what mama
Oh,
said.
yeah.
Big mama, big mama, however you call your loved one, Nana, Gigi, whatever. But I do think that sometimes there are times when you recognize that it is impossible for you to be able to provide the turning and positioning, the on and off the bedpan, the changing of the sheets. It can become insurmountable. And I've worked with a lot of families, and families will get to the point where they're like, I just can't do this anymore. So one tip is it's much easier to get your loved one placed from the hospital than from home.
Yes.
So if somebody mentioned having a fever and getting in for a workup, if you can get the loved one in the hospital for a medical reason and basically just say to the hospital, we don't have the care to provide for her. The social worker kicks in then. They don't kick in from home. It's way too hard to get a social worker to kick in from home. But if you can get them hospitalized, and if the family can come together and accept the fact, big mama's got to go here, even if it's temporary and you look for help, but it can happen much easier and efficiently from the hospital. It will very unlikely happen from home. It will take months.
I love that. I love that. I would also add to that. I learned the hard way that when my mother had an incident, to call an ambulance. She got taken much more quickly in the ER from an ambulance than from me going and sitting in the ER.
Right.
So call an ambulance, call 911. And it costs a little money, but trust me, it's worth the time that you're going to spend in the ER. But you learn these little tips by experience, real life experience. But at the end of the day, it's all about love. It's all about love, right? And treating others as you want to be treated, which are all of our grandmothers taught us, right? Anybody? Go ahead.
My perspective as a mortician, I would say planning ahead is everything.
Yes,
When it comes to wills, estate, trusts,
please get a will.
please get a,
Please get a
well,
will.
determine if
Will
it's
or a
better to get a
trust.
will or
Or
a trust.
trust.
For
Get
me, the
something
trust
on
is
paper.
everything.
Get
Yes, get
something
something
on
on paper. For the state of Texas, if you have 5 siblings and you've taken on the determination that I will take care of mom. When mom passes, it is now the responsibility of all 5 to agree on how mom's service and final disposition will be. If you're a cousin and you took care of your aunt and those kids stepped back and allowed you to do it, once she passes, you have no say-so. If it is not on paper, even if you have a power of attorney, that's great. But if you don't have right of disposition in that paperwork, that power of attorney ends when that person passes. You no longer have any rights. Any monies that you paid out to take care of them that you feel like you're owed, if that insurance policy does not have you as a beneficiary and they left it blank, it goes to their heirs. And those heirs are not going to reimburse you for a dime that you paid.
That's correct.
So when you get back home, it is important to talk to an estate attorney. I have no problem talking with you. I have friends all over the country that can potentially help, but get the paperwork taken care of now. You'd be amazed how many people sit at my table thinking that their loved one has insurance and they don't have it. Or they're the beneficiaries, but they got into a fight 2 years ago and they took them off. And now they're no longer the beneficiary. The house is supposed to be paid off, but they stopped making the payments on the premiums, the insurance lapsed. My mom is 80. She's been paying insurance for the last 50 years. It was $100,000. It's worth $300 now. It happens. Stop when you get home, while you're still on a high from Martha's Vineyard, you're still feeling great. Take 2 hours out of your time, make the phone calls, make sure everything is great, and then you can continue on with the rest of your life and you'll be good.
Yeah, for you and your parents. For
Yes.
you and your
And your
parents
children.
and your children. I learned that my sister was the financial POA. And that's a job I did not want to do. I delegated that job. I did all the other jobs, but now I'm the executor of the will.
Mhm.
And so her responsibility stopped. And I called the lawyer. I said, I need her to like get that job back. So I had to reinstate her as the executor of the will. I had to reinstate her as the POA for their finances. Because I still don't want to do that job. But she's now doing the finances for my stepdad over his children. Because they don't want to do it. So, but I do think when somebody dies, I don't know what happens to the people in the family, but the crazies come
Talk
out.
about that all day.
And you gotta be prepared as much as you can.
The more money, the more crazy.
Yes.
Or the more isolated.
Yeah.
The more
Yeah.
isolated the person, the crazier they were, because you can't prove that I didn't call every week, because the person was isolated. So it's never ideal, but there's something about pen to paper that just doesn't lie,
Right,
you know?
right. Okay. Thank you. Let's talk wellness, the finale. We'll do this again next year. Get ready. All right. Love you guys so much.